I'm A.M. Barrett, and this is Movement, Action, Space, and Vision. MASAV. Today I'm going to talk about a question I'm often asked about how we should use what we know about spatial function to inform other forms of cognitive testing that we might do. So Catherine Craver-Lemley and I in 2008, and a bunch of other people, published a paper in which we reported that the right side of the brain is dominant for spatial computations, right, for spatial judgments. And because the right side of the brain is dominant, we weren't the only ones to report that. A lot of other people have reported it, as I said. You might think that asymmetric spatial behavior causing functional disability is just a right brain syndrome. And that's the way that most people think of it. But in fact, it can occur, spatial neglect can occur after other forms of brain injury, and it can occur after left brain injury. My colleague Jean-Marie Baïs in France and a number of others at other times have reported that neglect after left brain injury can occur in as many as 1 to 4 out of 10 people with left brain injury, and many of these people might have aphasia. Aphasia being a disorder of speech and language that causes a functional communication problem after stroke. And so because we have to test people for aphasia, for functional communication, how can we take into account the fact that they may also have a spatial disorder? Do we need to worry about adjusting the testing for a possible spatial disorder? And the answer is a resounding yes. We should adjust what we do. So let me give you 2 examples. Naming. All right, so this is a typical stimulus we might use for naming. And it's just a picture, and this is a picture of a hammock. Right? So if we're showing this picture to someone who's had a left brain stroke, and that person has not only aphasia but also spatial neglect, that person may have difficulty with the right side of the stimulus. And thus that person might see something like this, right? The highlighted part. Or the person may be mostly aware of this area where I've circled, and there may be relative unawareness of this area. Well, you can see it might be hard to name the hammock if you can only be most aware of this part, right? It might look kind of like a broom or a kite, or you might not be able to kind of figure out what this object is supposed to be at all. And so when we're doing naming with somebody who has aphasia, who's had a left brain stroke, what we probably should do is always start in the preferred space, especially if we're not really aware, if we're not able to fully test for spatial neglect. And so if we put the stimulus in the preferred space after left brain stroke, that would usually be the left space. And we go ahead and say, what is this object?
That's a hammock.
Excellent. All right, so we can do the testing in the good space, and then if we wish, we can do testing in both spaces and compare. And if someone can name the stimulus in this space but not in this space, that tells us something about how spatial neglect is affecting the person's language function. Now, another form of language testing that we should adjust is anything that involves an array. Because again, distributing spatial attention over a space is going to be hard for someone who may have spatial neglect. So this is a task that my colleagues in Italy, Martino, Pizzamiglio, and Orzano, in 1976 published. It's a really nice version of the token test called the 3-object token test that you give with concrete objects, and it's a great way to test syntax. So in this test, we can test not only whether somebody can name objects, but whether they can understand relationships between parts of speech. And what we might do in this kind of a test is ask the patient to manipulate the objects according to grammatical rules. So, with the pen, touch the keys. So if the person is having difficulty, sure, that may be a grammatic difficulty, but here you see the keys are at the right side of the array. And if the person is having trouble with spatial attention due to a left brain stroke, it may be that that area is neglected. So what we can do, thank you, what we can do is we can put all the objects in a vertical orientation in the good side of space. So really to do the 3-object token test in the best way, what I would do first would be to go ahead and have the person name the individual objects or show the comprehension of the individual objects. So please show me the pen.
Right here.
Please show me the book. Please show me the keys. Excellent. Now with the pen, touch the keys. Excellent. So when we test in the good space, again, we could compare performance in the good and the bad space, but we remove the adverse influence of difficulty with awareness in right space, and thus we remove the contaminating influence of spatial neglect.